The Paris Declaration adopted in 2005 to improve the effectiveness of aid works. This is the conclusion of the biggest evaluation of aid ever. Paris Declaration reforms have led to improved development cooperation and to making aid more effective. One of the results of this is better health in many developing countries like Bangladesh.
Our life expectancy for female is now 67 years and for male is 65, which is comparable with perhaps with any developed or developing countries.
Many other developing countries, including Uganda, have seen similar improvements.
I think overall, if we look at the performance of the health sector over the past 10 years, definitely there has been enormous improvements in many areas.
There has been an impact on the ground. Of course, there are challenges which have been coming along as we move, and those are the ones which keep us busy to sort out.
The evaluation of the implementation of the Paris Declaration is based on country evaluations of no less than 22 developing countries and of 18 donor countries and agencies. It confirms the experiences from Bangladesh and Uganda.
There's already a clear contribution to better health services for people. And I think you can see a real change. Frankly, we were surprised at the extent to which that has accelerated in many, many countries.
But the evaluation also concludes that both donors and developing countries still have a long way to go to make aid contribute more effectively to development and eradication of poverty.
There's a need for another big push and some straight talk.
This is the climax of all these days of rejoicing. And to replace the Union Jack, the black, gold and red flag of the new young state, Uganda is born again, free and independent.
Development aid at scale started some 50 years ago when former colonies, like Uganda, gained independence. Inspired by the Marshall Plan, the large-scale American four-year program to rebuild European economies after World War II, hopes were high that the young, independent nations just needed a few years' support to be able to stand on their own feet. These hopes proved over-optimistic and ignored the fact that many of the new nations were to build up government and administration systems virtually from scratch and with very few trained people. A multitude of donors came in to not only finance but also, for lack of robust national systems, deliver basic services. This did little to build up local capacity.
In Malawi, aid was basically donor-driven. Development partners would come and they could come up with, even drawing up with the programs themselves, coming up with the documents, document programs, and tell us what it was, and we'll go and negotiate on the basis of what they have given us already.
Big donors were there in our country, like the World Bank, ADB, UNDP, and all these, and there was no coordinated effort.
Ils choisissaient eux-mêmes les secteurs, ils choisissaient eux-mêmes les régions dans lesquelles on doit dépenser cet argent-là.
The important thing was to get the money out the door, to get the loans agreed, and it was kind of assumed that good results would follow.
Aid effectiveness suffered from the fragmented donor approach. So did basic service delivery in one of the sectors where many developing countries depend heavily on aid: health.
Many projects, many programs we were operating were running in silos, and there wasn't adequate horizontal coordination. And of course, the ultimate results, the impact on the ground, was not what we had desired.
National systems, including the national health systems, suffered from the pre-Paris way of giving aid. A wide range of donors were running projects with a focus on delivering health services to people, the beneficiaries, more or less bypassing the national health system and administration.
If you do project support, you can help a lot of people to get access to better health services. But it will be like small islands everywhere.
While those directly reached by the various projects benefited in the short run, it did little to build up and strengthen national capacity and systems.
Some people used to say that you name any disease in the world, you have a project for that in Bangladesh.
In the 90s, both developing countries and donors increasingly questioned the project approach. They developed a different vision. Donor support should be provided in a harmonized way through national health systems which are, in the process, strengthened.
By talking locally with our development partners and stakeholders, we felt if we work together for the common goals, for the common good, expecting good results, would, bring out greater efficiency.
If you really want to make an impact and have a stronger impact on the health of people in the whole country, it's better to join forces with others and try to make sure that it's actually the Ugandan government who should do those things.
The idea was to minimize the number of projects in order to gain the best value for money.
Distinguished ministers.
In 2005, efforts to improve aid effectiveness in Uganda, in various other countries and at a global level, culminated with the adoption of the Paris Declaration on Aid Effectiveness.
And I hereby declare the Paris High-Level Forum closed. Thank you very much.
And the Paris reforms have improved aid effectiveness. One of the results of this is better service delivery in the health sector.
When we talk together as donors, we get a landscape vision, a holistic approach towards healthcare delivery. We look at how activities can complement each other for greater benefits of the society.
There's a much better understanding today about the need to really coordinate work within a sector approach, trying to align our resources and support a government-led program. And in that way, I do think it has really changed the way that agencies, organizations provide aid.
The Paris reforms have also improved development cooperation at a more general level.
I think the great thing about the Paris Principles and the Accra Action Plan is that it's provided political, high-level strategic direction for governments, for recipient partner governments and for donor governments and agencies.
The Paris Principles are all about getting a biggest bang for your buck, so making sure that the aid that countries provide is used in the most efficient way.
It doesn't matter where the money is coming from. What matters is whether the money that is being contributed by all development partners is being used to achieve the objectives, is used to achieve the targets.
Previously, the consultation, the dialogue between the government on one side and the development partners on the other side was limited and also fragmented. Now this dialogue, this consultation is much more structured, much more regular and much more focused.
20 years ago, government approaches individual donors to discuss their own strategies for Uganda. Individual donors basically operated without consultation with one another. Today, it is we are in this together.
But the evaluation also sends a clear message that both the donors and recipient countries have homework to do. Partner countries like Bangladesh are to take full leadership.
Because of this long-standing culture of donor domination, and I think that is true about not only in Bangladesh but about many, many countries for a variety of reasons. And coupled with the lack of capacity of the government is yet to assume the driving seat. The selection of sectors and modalities for aid are often determined by the donors.
Partner countries should also be serious about fighting poverty and corruption.
In many, many countries, the key priorities of poverty reduction, reducing inequality, particularly for girls and women, and continuing to reduce corruption are things that need not only rhetoric and not only some of the sort of procedural things which are happening, but a real political push.
To donors, the recommendations are just as clear. One is to make use of country systems.
Although in principle all the development partners are committed to accept, to follow our systems and procedure, but in reality many of them are yet to do it.
They are reluctant to do this in many cases because they say, we're not 100% certain that these systems are sound, that corruption can be avoided as much as we need. So we say those should be strengthened, those systems should be strengthened in order to be able to manage those resources. You can only really help a country improve its systems by using them. You have to accept risk.
Obviously there is a catch-22 situation, and if you want to build public financial management systems, then at some point you will have to move forward into actually using these systems. No development partner wishes to be caught with his pants down, meaning that your funds, your taxpayers' funds, are being used through faulty systems or good systems not being correctly applied.
This risk aversion and the giving to our own populations the idea that you can avoid risk is an illusion.
We have these capacity constraints, but that should not be used as an excuse for not following the country systems or for denying to accept country ownership and leadership.
A recommendation to both parties, donors and recipient countries alike, is that they should bring on board the ever more important emerging donors like China.
China has been here for a while, and basically they do projects from beginning to end. Their major undoing is the fact that those projects seem to be standalone projects without little embedment in the government systems.
And there are new relationships out there. The BRICS, the so-called BRICS, the Chinese, the Brazilians, and so on, are becoming a major factor in this, and we have to work with them as well.
A general message to both parties is that Paris reform implementation should focus at country level.
A key finding from this whole evaluation is how different, how diverse different country situations are. And therefore, it's time to push it back to the country, where the country itself can lead this effort in working with its donors.
In late 2011, the high-level forum of the OECD DAC Working Party on Aid Effectiveness is meeting again in Busan in Korea to take stock of the implementation of the Paris Declaration and to map out the way forward to improve development cooperation. And the overall message of the evaluation and various stakeholders is clear. The Paris Declaration set the right direction. Now follow it.
My recommendation is just one, total. We must walk the talk. If we are signatories to these Paris Declaration principles, and we believe in them, and we believe that using these principles will help to deliver the services, then let it be so.
The Paris Declaration, first and foremost, I think, was speaking a very bureaucratic language. But Busan should speak a language that speaks to the politician, that talks to how politicians should reform institutions to ensure that aid becomes an important, significant, and well-grounded part of development.
Unless the political will prevails, nothing happens in a country. So we have to pay serious attention to that.
We really do need to see the goodwill, the collaboration to solve real deep human problems together.